Judy. And right now I have Dr. Adeogun. What's the middle name, really? Wait. What's that? What's the middle name again?
Adedamola Adeogun. But a lot of people call me Charles.
Dr. Charles
Yeah.
Adedamola Adeogun.
Absolutely.
Welcome to the studio.
Thank you. Good morning.
Welcome. Good morning to you. Everyone, this is how I want to do this. Feel free to send a message right now via our WhatsApp. Our WhatsApp portal is open for your messages and for your questions, because I know a whole lot of questions will come in today. I am very, very sure. All right. So the WhatsApp number is 081 717 56338. 081 717 56338. Okay. And if you okay, maybe I should hold on with that for now. Now, doctor, let's talk. The last time you were here, it was like it was a big one though. But then I got several other questions. Abi doctor, and I can answer these questions. I got several messages, and I'm trying everything possible to touch on, some of these areas. I might not be categorical right now. I might not be. I'm not a doctor. Let me just leave it like that. So that's it. But then there are several issues, several health challenges I would want to talk about today. People are passing through or facing several of this, from asthma to autism to breast cancer to inflammation to kidney disease to lung disease, obesity, reproductive health issues, and all of that. And let's take it one by each. This morning, some persons have asked several questions on how to actually deal with autism. Autism is one big deal. I would want you to help us understand this. Let's start with that one.
Okay. Thank you. Autism is a condition that
You might want to adjust the microphone to yourself. Yeah. Okay. Beautiful.
So it's a condition that comes as a spectrum. So they call him autism spectrum disorder. And typically, a lot of children are observed to have this kind of condition from childhood. And basically, it's characterized with loss of inability to communicate or have good social connection or social interaction. So typically, a child who is autistic would typically be into himself, would be in a world of his own, so to say. So there may be a problem with speech, there may be a problem with communication, and they typically have what we call ritualistic behavior, meaning that they repeat things like a repetitive action. So they are fixated on one thing and they keep doing that one thing over and over again. And typically, it has also been shown that because they do not communicate well, they're probably seen as children that would have some other learning disorders or difficulty in learning. So typically, when you go to school, a child is expected to be responsive to what is happening in his environment. Is expected to follow what the teacher or the tutors are doing and be able to, comprehend and fully participate in whatever activity is going on. But typically, children that are autistic, they've been found to really find some kind of learning difficult and speech and communication a bit difficult. But it has also been shown that autistic children can also have some very unique skills or talents in some cases. You find that they are actually very smart, and early intervention is always very, very important, because by the time you quickly detect that a child, is having a little delay in some of the milestones, you visit a pediatrician. The pediatrician runs the necessary investigations and may involve other specialties, maybe the neurologist, the speech therapist, and eventually even a child psychologist may be brought into the picture, so that you can quickly identify what peculiar problem the child has and you can put the right solution in motion. Basically, a lot of people who were born autistic actually over time with good support, do very well. particularly those of them that attend special schools and have special teachers. That's some kind of privilege that comes with
Yeah.
you picking these things early. So it's important to know that when you notice something in a child, please do not just assume that it's always normal. Always go to a professional to actually evaluate the child and then run all the necessary investigations. And also, you also want to ask if there's a family history or a trend of close relations having similar situations or siblings having children with such disorders also. So it's very important that you have a very high index of suspicion, especially for children, because there are lots of developmental issues a child can have. A child can, we call some things in pediatrics developmental milestones. At a certain age, a child is supposed to do certain things. At a certain age, a child is supposed to have the social smile, sit up, neck control, crawl, walk, and all that. But if you find out there are any delays in any of this, don't just assume. If you find out that a child is not speaking when the child is supposed to speak, or the child is trying to mutter some words that are not clear, or the child is not completely in touch with the environment, it's a source of concern. Sometimes it may not even necessarily be autism. It could even be a hearing disorder the child has.
Okay.
Because if you have language or speech difficulties, sometimes it's not just something that is centrally a centrally located problem. It could be because there's a hearing difficulty. Because one of the best ways, in fact, one of the only way to even learn language is through hearing. So if you are hearing impaired, it will be impossible to have good communication, and there will be language disorders from there. So it's very essential that parents and caregivers and guardians, and teachers in school to pay close attention to children, and then know when a child is not given the right attention or not responding appropriately, as expected, so that we can put the right things in place to get a good outcome.
Beautiful, beautiful. I love the way you broke it down, because I've asked several questions as regards autism, and little answers were given, but now I think I quite understand. Now, one more thing I would also want to mention. I want to mention a couple, though. Just give me time. That the other thing I want to mention is breast cancer. People might want to find out what really causes breast cancer. When should you visit the hospital? 2, how can this be treated? Some will tell you it cannot. Once you have it, you're gone. Like if you are diagnosed with breast cancer, forget about it. We'll just count your days. But is that true?
Not necessarily true. Like we say, for most illnesses, early detection is key. And once you detect cancer, any type of cancer in the earliest phase before it starts spreading to other areas, then you have a higher chance or likelihood of having a good outcome. There are a lot of breast cancer survivors. There are a lot of people who were diagnosed years ago with breast cancer, but because it was detected on time and they were willing to go through the right process. Yes, they were willing, they made up their minds to follow through and get correct guidance from a professional. Because when most people hear the diagnosis of cancer, many things, travel in their minds. They start thinking of, are they going to die? They start thinking of how expensive the treatment is. They start thinking of, am I going to lose a part of my body to surgery? I don't want the chemo. I don't want the radio. But the truth is, once that diagnosis is made, it is not up to the patient to say, this is what I want. It is up to the professionals to advise you, because they have seen different cases, similar cases, and they know what best to do. So they're in the best position to let you know, madam, you have come with this, and we have done all our tests, you've done the mammograms, you've done your biopsies, and we've confirmed that this is cancer. So we need to do a mastectomy, that's taking away of the breast. Most people that I've seen that have done well have just said, please, I'm ready to do anything I need to do to be fine. So they get the breast out. Not only do they get the breast out, they get the axillary lymph nodes out, because cancer spreads mainly through the blood, through the lymphatics, and through contiguous spread to surrounding tissues. Like it just moves from one structure to the other. So basically, when they remove the axillary lymph nodes, at least you're stopping that spread through that route. And then you're getting off the breast surgically, and they're going to be on some chemotherapy. They are cytotoxic drugs that help to kill the cancer cells off. And in some cases, they may say
Okay.
you need to do radiotherapy to get some of the remnants out through radiation. And of course, there will also be some hormonal drugs also that they may need to be placed on to make sure that everything is kept, to where it is. Because cancer, what actually kills them is the spread. Because it originates from the breast, but at the end of the day, it spreads to the liver, can spread to the brain, can spread to the bones, can go practically anywhere in the body. And that's what kills them eventually. So most of the time, prevention is better than cure, like we all know. So we need to advise women in particular, but we should also note that men also do have breast cancer.
Oh, really?
Yes, men do.
Men?
Yeah, absolutely. Men can have breast cancer too, but it's not as common as what you find in women, but it does happen. So when a woman, goes for her regular health check, that is why we keep saying, please go for your annual health check. If you are less than 40, go for your breast ultrasound. If you are above 40, go for your mammograms. And if anything is detected, please do not run away. That is not the time to disappear. Because most times when people hear a diagnosis that is unpleasant or undesirable, you just don't see them again. And they go elsewhere seeking other options. And most options that they look for are not the right options. That's not the time for you to try spiritual help. That's not the time for you to go looking for some kind of natural remedy that is not verifiable to actually be effective in the treatment of breast cancer. So you need to just stay put with your health professional. Make sure that you're seeing the right person. Make sure that you go through all the relevant investigation. Once your diagnosis is confirmed, just subject yourself to the treatment that is required and for the duration of time. Because it's one thing for you to start a correct treatment, and it's another thing to follow through that treatment. A lot of people default at some points. They come, for the first few visits and they just disappear. They just tell you, oh, I'm not in the States or I've traveled. And by the time they come back in a very horrible state when things are so bad and they're expecting magic to happen. So basically, it's important that we know that breast cancer is real. It can kill.
There's this thing they say, I hear people say, traditional method of tackling breast cancer, and then these, orthodox way of doing it. I don't know which one works. Which one would you say?
Well,
Because
I am not a traditional doctor to start with.
you not be herbalist.
I'm not a herbalist, but I can
Okay.
tell you that certainly I agree with the school of thought that before the white man brought modern medicine, there was a way people used to heal themselves. There was a way they cured diseases and all that. But I'm not sure they had this kind of disease at that time. And besides, anything that is not verifiable, anything that hasn't gone through series of tests with a study population, knowing that it is actually effective for what it is said to be for, and it has stood the test of time in terms of being efficacious and having minimal risk to the health of the individuals that have taken the medication, then it's not something you want to try because your health is too precious. It's not something that you want to do trial and error for. So it's essential that we tell people, please go for what is tested and trusted. Go for what has worked over and over again, time and time again. Like we said, cancer is something that we've not fully understood, everything we need to know about cancer, because cancer has a genetic basis. It also runs in families. People have certain genes called oncogenes. Those are the genes that predispose you to developing breast cancer. Like for breast cancer, you have the BRCA1 and BRCA2 genes. If you have it, you're likely going to have breast cancer. So if you have a positive family history, either in a mother, in an auntie, in a sister, the risk increases. If you are obese, the risk increases. If you smoke and drink alcohol, the risk increases. If you have been on oral contraceptives for a very long time, it could also increase your chances. And then for people who, for any reason at all, they notice they have a breast lump. And how do you even know you have a breast lump? You must do a self-breast examination. We advise women to do a self-breast examination. Just stand in front of a mirror, use the palm of your hand, cut each breast into 4 quadrants, palpate each quadrant, and then feel for any lumps or masses. They don't have to be painful. Any lump you see, please report. Not all lumps are malignant. Not all lumps are cancerous. So that is not for you to decide. It's for the doctor that examines you to decide whether it is cancerous or not. So once you notice that anything that feels different is there, please go to the hospital. get your scans done, get it examined. If your doctor says you need to do an excisional biopsy to remove the lump and send to the lab for histology, then so be it, because that is the best way you can make a diagnosis of cancer. Nobody can ever diagnose cancer without a biopsy report, because it is through that biopsy that the components of the tissue of the lump is actually analyzed to detect if cancer is present or not. And if cancer is present, then the line of treatment and management is completely different. But if it is just fibroadenoma that happens to young women sometimes, that is a benign lump and you really have nothing to worry about. But before you even know it's fibroadenoma, you still need to send for histology. So the histology would confirm whether it's actually malignant or benign. And if it is malignant, please and please, I still plead again, please do not run away. That is the time for you to actually be most attentive, change your lifestyle, change your diet, and then follow all the doctor's recommendations so that you have a desired outcome. Because that's the best way. Because if you just try other means of or other available options that seem to be available, you may actually be making a very terrible mistake. Because at the end of the day, people come back to the hospital they ran away from when things go bad, and they expect a miracle to happen. But at that point in time, things are advanced, and the doctor would say, if only you were here 6 months ago or 3 months ago, things would have been different.
But the question is, what actually causes breast cancer?
Like I said,
why is that thing so stubborn?
Well, breast cancer, you have oncogenes. Like I said, there are certain genes that are present in people that predisposes them to such cancers. So the oncogenes are genes that cause a mutation in the cells. So when there's a mutation in the cell, there's a change in the way the cell responds to cell division. Normally, our cells divide, but there is a programmed method of cell division. But in cancer, there is uncontrolled cell division. So that mechanism of control that keeps the cell division in check becomes altered. And then you now see the cells multiplying wildly and crazily. And then you have more abnormal cells clumping up together to form the lumps and the tumors that you see. So a genetic basis, first and foremost. Oncogenes, that's the genes that are responsible for cancers. And then lifestyle also. People that eat a lot of processed food, people that are obese, people that do a lot of alcohol, drinking, smoking, all those increase your risk of cancer, because some of these things, contain carcinogens. Carcinogens are substances we come in contact with that lead to cancer. And there are many things that we eat today, that we use today in form of cosmetics, in form of skincare products, in form of hair dyes or whatever, that increases our chances of developing cancers. And there are lots of things that we love eating and drinking because they taste nice, but they contain carcinogens. So it's important that we eat less of processed food. So the advice is, if you know you have a family history of this kind of condition, then your lifestyle needs to be intentional. You can't just eat anything. You can't just live your life anyhow. You have to be intentional if you don't want that trend to continue.
Thank you. One more thing is, what do I call it now? Reproductive health issues.
Reproductive health issues, has to do with both men and women, because it takes two to make a child.
You know why I'm saying this? Because it's causing a lot of issues in the home, the family.
Of course, yes.
The husband will say, no, you are the one. You are the one. And the wife will say, no, it's you. It's what you give me that I carry now. You know these things. And, a lot of men, families are passing through these issues. No child for more than 5, 10, 15, 20 years.
Or they have a child and they're trying to have another, and it's...
So talk to us about it.
Well, infertility is an issue that is really profound, because it brings with it psychological, emotional, even mental health challenges. Because a lot of people, with the kind of society we live in, there's a lot of emphasis placed on, you need to have a child. You've been married for a year. You've been married for 2 years. What is happening? Is there a problem? Do you need us to intervene? Even unsolicited assistance starts coming from different quarters. And basically, it's a broad topic because, like I said, 2 people are involved, and the 2 people need to be fully and thoroughly examined. Because if one person has an issue and does not realize that the issue is from him, or does not realize the issue is from her, then it gets complicated, because no matter how hard you try, you're still not going to get what you want. So basically, our society has made it like, from our culture, if a woman can't conceive, it's most likely the woman. What is wrong with her? Is it that she has a problem with her womb. Does her womb need to be flushed? We've heard all sorts of things like that. She needs to clean her womb. Her womb is dirty. I don't know where they get all that from. All those notions may be wrong because the woman may not even be the one responsible. So both parties need to be thoroughly examined. As for men,
Sorry, before you go on, wombs are never dirty, right?
well, the truth is, you can have pelvic inflammatory disease, you can have some infection, but when they say the womb is dirty, the womb needs to be flushed. But you look at the people who are giving this diagnosis or making this diagnosis, are you medical professionals? So, okay, the womb is dirty. So, what are the methods that you want to use to clean the womb? And by the time they start giving you the options they have available, of course, it's a no, nobody's going to do that. So, basically, if let's start with the woman because a lot of women, I think they are more affected than I know the men are also affected, but I think the woman it takes a toll on her because of the emotions. The pressure is on her a lot to have a child, and she's also concerned about menopause. As she's getting older, she's worried.
Yeah.
So basically, when a woman is finding it hard to conceive, there are a lot of factors to consider. She needs to consider the fact that is her menstrual period regular? Does she ovulate or she has anovulatory cycles? Does she have any form of hormonal imbalance? And then does she have what we call PCOS, especially when the menses is irregular and she's adding weight and she's having acne outbreaks and even if she gets pregnant, she's always having recurrent miscarriages, then a high index of suspicion must be towards the polycystic ovarian syndrome, the PCOS. And there's a lot of cases of hormonal imbalance too that can happen. Sometimes women have what we call hyprolactin. The hyprolactin, that's a hormone that helps in lactation. Normally, it should rise, towards the end of pregnancy in preparing for lactation. But some women in their non-pregnant states will find out that because they're having irregular periods, they go to do these checks and they find out that prolactin levels are very high. So if your prolactin levels are high, you are likely going to have irregular periods and you are likely going to deal with infertility issues. And you may not know because it's not all the time you have a milky discharge, nipple discharge. Some people, they have it so high that they actually see a milky discharge, So that is not something to be ignored because it's a signal that you just had a child and you're lactating and you cannot get pregnant. So until you address that high prolactin levels, you're likely not going to get pregnant. And if you're having any irregular periods, you need to have your thyroid functions done to find out why you're having the irregularity in your periods. You must also find out if your tubes are patent, the fallopian tubes, because if fallopian tubes are not patent, there's no how you can have fertilization, established, because the eggs must be fertilized before it is implanted in the uterus. So if you have blocked tubes, which is commonly from repeated improperly treated infections in the past, pelvic infections, STIs, that was not properly treated, you can now see that there's an aftermath of some of these infections. So you have an STI a long time ago, you just treated or never, some of our people, they have a problem with, give them medications, take it for 10 days. By the third or fourth day, they think their symptoms are gone, they stop taking the drugs. And they say, I'm fine, and they throw the drugs away. But the doctor that asks you to take it for this duration of time knows exactly why he gave you that length of time for treatment. At the end of the day, if you continue having, we call it sequelae or consequence of that improperly treated infection, you can have blocked tubes, and you may start dealing with infertility in the future, and you don't know where it's coming from. So that's also a possibility. And for a lot of women who have had repeated D&Cs in the past.
Okay.
Each D&C you do, sometimes if it's not properly done by a licensed professional, we don't even want to talk about all sorts of things that happen now, where some people that are not licensed to do certain things are doing certain things. You can now have what we call Asherman syndrome. There is fusion of the uterine walls. You don't see your period for a long time because there is scar tissue there. How would you conceive when your menstrual period isn't regular? So those are the real challenges that a lot of women may be facing. Then after your question, then I talk about the male factor.
Okay. Now, I wanted to ask you, irregular menstruation that is caused by pill intake. Maybe some of these
contraceptives
to stop pregnancy, for instance, or to avoid pregnancy. And you now discovered that your period is not the way it used to be. It comes this month, next month it doesn't, or even if it comes just little of it, and it's just
It just messes things up. Yeah, I think it still comes from where people are not properly informed, because contraception is a valid aspect of healthcare, of female healthcare. Part of women's health, contraception is a major part of it, because we want you to plan your family. Because each pregnancy can be a potential risk to the health of a woman. So we want you to be able to plan your family such that you don't just have unwanted pregnancies. So contraception addresses that. So if you want to know what contraceptive method is suitable for you, or is ideal for you, then you have to go to see a gynecologist, a professional who is specialized in dealing with such cases, who will be able to tell you, based on your history, based on my evaluation of your health status, this contraceptive method is suitable for you. But because of other factors you have, maybe because of your family history, or because of some allergies, or because of one thing or the other you've had, these other methods are not suitable. But if you don't go to a professional, who would analyze it for you? Nobody. You just go in and hear that your friend took something and you think it probably worked for the person. Well, maybe it did, but it may not be ideal for you. So at the end of the day,
so there are specific.
There are different types of contraceptive methods. So for family planning,
that is suitable for some persons.
Yes,
right?
suitable for some persons. While for other people, they start noticing they are gaining weight, their BP starts shooting up, they start having recurrent infections, or they may start having other undesirable effects. So it's very necessary that you see a licensed professional who gives you the right guidance and counseling. Because before you embark on any type of contraception, both parties, the spouses, must be present, and they discuss the suitable options, and they decide what they want to do, in line with what the doctor has suggested for them. So it's very important that we stop the idea of self-medicating or taking major health decisions on our own. That is very rampant in our society, and one of the main objectives of this talk we're having is to let people have the awareness that you need to seek medical help. That is why the doctors are there. That is why the hospitals are there, to guide you, to give you the right advice in a timely fashion. So it is when you need it that they tell you this is what you need to do. It is not that you've already made an error, or you've taken some drugs that have already caused some harm, and then you're now coming to looking for remedy to whatever the damage done has been. So it's very essential that you don't run away from the hospital. The professionals are there for you. That's why they're there. And they're always willing to help you. So when you present there, they are able to give you the right guidance, and give you the timely information that you need. And going back to the male factor is very essential.
Before you talk about the male factor, right?
Yeah.
Everyone, this is VOPFM. Feel free, all right, to just send a message right now via WhatsApp, okay? Via WhatsApp 081-717-56338. 081-717-56338. I'll just take 3 messages or 4, and then so if you own first come, fine. Okay, doctor, you
yeah,
for male.
Yeah, for the male factor. Our society, the male is expected to be macho, never having any problem, never having any concern, always on point, So men are less expressive. They don't even seek help most times. Either psychological, mental, physical help. They just think, you don't need to express how you feel. You should always bottle it in and find a solution to whatever your problems are. And that notion needs to be changed. You are human, you have feelings, and you need to express those feelings. So first and foremost, most of the challenges relating to infertility, regarding the male factor, involves the seminal fluid analysis, because basically that is the gametes anyway, the medical term is called gametes. That's what the male produces, the sperm. So a seminal fluid analysis gives a thorough assessment of the quality of the sperm and how likely, the person is able to achieve pregnancy or to impregnate a woman. So first and foremost, you look at the counts, the sperm counts, and you need a minimum of about 20 million sperm per mil of sperm. Typically, most males produce about 2 to 5 mils, just like a teaspoon of semen, and you want about at least 20 million per mil, 20 million sperm cells per mil. That's the concentration of sperm. And you need good motility. So it's not just that the numbers are high, you also want a good high number that are motile, actively motile, because those are the ones that will swim all the way to achieve fertilization before implantation takes place. So for the main parameters in the seminal fluid analysis are the sperm count, the sperm motility, the sperm morphology, which is the form. Everybody has some abnormal forms, but you want the good forms to exceed the abnormal forms. All right. And then you also want a semen culture to be done just in case you pick up an infection in the semen. So basically, some men, these parameters they can be haphazard. Some men have good counts, but the motility is very poor. So there's still infertility because you need good motility. Some, they have high, the morphology, you have the forms that are very sluggish, you have the forms that are deformed, forming the majority, then infertility still occurs. Then also you now have those that may have satisfactory motility rates, but the sperm count is extremely low.
Okay.
So you need to find out which is which for a particular person. And the only way you can find out is to go for this test. And this test is usually done after abstinence, and then you send it to the lab immediately for analysis. And once the parameters are out, we're able to detect where the problem is. Do we need to work on the motility? Do we need to boost the sperm count? Do we need to treat an infection? And we may also need to tell the man to adjust his lifestyle. Those that drink a lot of alcohol, those that are obese, all those factors we also put in check to ensure that at least they don't have any other thing like erectile dysfunction that can possibly complicate issues for them. So basically, a lot of men refuse to even come for the seminal fluid analysis most of the time. So when you have a couple that are seeking to conceive or have children, you find that the woman, complies with all the tests and all the recommendations mostly. But you find the men always saying, I've traveled, I'm not around when I return from my trip, I've done it before, do I really need to do it? There's nothing wrong with me. No, just check my wife, I'm fine. And I believe sometimes it's kind of living in denial, because what is there is there. If you have a problem, then unfortunately, if you are not seeking timely solutions to that problem, then that problem would persist. And in some cases, we have what we call azoospermia. Azoospermia is a condition where there are no viable sperm cells at all in the semen. So that happens. So you can imagine a man who is azoospermic attempting to achieve pregnancy for his wife. That is almost like a tall dream. So it's almost impossible, and you don't even know what the diagnosis is, and you just keep pushing your wife to the hospital to get herself checked. But whereas you also have a problem that should be addressed. We found cases where both parties needed to be treated for about 3 months, and they were able to achieve pregnancy afterwards. So our counsel or advice or admonition to people now is that if you're dealing with infertility issues, both of you should present at the hospital. Both of you should be subjected to the relevant investigations. And once the results are out, please don't be in denial of anything. Whatever it's science. Whatever results come out from the reports, just ask the doctor, what is the next line of action? What are we expected to do? How do we take it up from here?
Okay.
And whatever recommendations are given, you please comply. And at the end of the day, you would actually smile, because it's just for you to do the right things. And
Doc, I hear people say once a lady is above 40, it becomes difficult for her to get pregnant. Is that true? 40 upwards.
To an extent, yes, because you have what we call the ovarian reserve. The number of eggs a woman has, reduces with age. So there's a particular test we call AMH, anti-Mullerian hormone. It helps us know the ovarian reserves of a woman. So typically, if it's less than 1, the woman's risk or the woman's likelihood of conceiving drops. So the lower the AMH, the lower the ovarian reserves. And this tends to happen with increasing age. So definitely a woman's fertile period are those younger years, certainly, because a lot of things happen. Nowadays, we have people achieving early menopause, for instance. Typically, menopause should be between 45 years and 55 years, on the average about 51 years. But now we're having a lot of women in their early 40s beginning to say, I've not seen my period for months, I'm not pregnant. And
40 years.
Yeah, early 40s, they're beginning to have perimenopausal symptoms. They're beginning to have those symptoms that are signaling that menopause is near. So if that woman has not completed her family by that age, then, you know, the chances of her conceiving drops, you know, and you know that after menopause is achieved, pregnancy is almost impossible because of the massive change in hormonal distribution and hormonal balance in the body. Because menopause is a different phase in a woman's life. All the hormones that were typically high during her fertile period, during her reproductive years, you know, there's a decline in them. And there are new symptoms that come in, like the hot flashes, the mood swings, the depression, the bone pains, osteoporosis, hypertension, insomnia, and all sorts that come with menopause. You know, they start presenting, you know, when people are in their 40s. And some people by 45, they've already attained menopause. You know, so sometimes it's actually a valid concern for women as they get older that they really need to do something about conceiving, especially if they've not been able to achieve conception. And we've also seen in cases where people have actually had 2 children before, a couple had 2 children before, and to have a third child is completely impossible because now they
problem.
yeah, because the man now has low sperm count and the woman probably has some other issues too. So sometimes you have primary infertility and sometimes you have secondary infertility. So it's important that you see a professional who give you the right guidance on what to do, and making sure that you doing all those things in a timely fashion, you get what you want.
But the one more thing I would also want to ask you is the issue of sight. People are losing their eyes. Young people, you know, they call some cataract, they call some, what's his name? This popular thing I hear people call now. Glaucoma.
Yeah, there's
you
glaucoma,
know,
there's
40,
cataract.
45, 50, 55. In fact, from 40 to say around 60, 65 or 70 as the case may be. Glaucoma. They are not seeing anymore. Or this blurry vision and all of that.
Okay, when you talk of vision, of course, we know that that's one sense organ, the eyes, an important sense organ that keeps us in touch with our environment, that helps us to perceive things in our environment, that helps us to be able to conduct ourselves the way we should, and saves us from danger also. But unfortunately, certain conditions, you know, take our sights away. For instance, cataract that you mentioned, typically it occurs in the elderly age bracket because it's mainly the lens of the eye becoming opaque. Normally it's meant to be transparent, but over time there's a process of glycation that happens that causes cloudiness of the lens, and then you find out that the light rays that enter your eyes cannot get to the back of the eye to produce the right images. So that cloudy lens needs to be changed. That is what the cataract surgery is all about. That is the most effective treatment for it. Most people who have had,
because I know
lens
somebody right now
changed-
who told me that if she opens her eyes now, she could see some sort of darkness. You know, just one eye. Okay, it's dark. She can't see through the other person. You get, but there's a shadow in between. You know, I don't know, before the person. I don't know if you get me.
Yeah, I understand what you're
There's a
saying.
shadow then, so she won't be able to see the person on
Person.
the other end.
Yeah, so you know there are different types of eye conditions. The ones that can take the vision away completely, the cataracts, the glaucoma, the macular degeneration, all those can steal your sight in no time. So mainly cataracts are, you know, common in the elderly and in diabetic patients. You know, they can develop cataract early, and then you can now find out that the lens is cloudy, they cannot see well, and after a while, you know, a lot of people will promise them, take this, use that, apply this in your eyes, the cataracts will clear. Please let us make it clear now. The only way to treat cataract and treat it effectively and restore your sight is through a surgery. And the surgery
The
is
only.
yes, that is the only valid treatment for cataract is a surgery. And once the surgery is done well, the person feels like he's alive again because he can see. And you know, this can come with depression too, knowing you could see before and
And see
now
that?
now you
Yeah.
can't see. Now you can't make decisions. People make choices for you. You don't even know what you want to wear, or you don't know where you're heading to, so all that can be corrected by a surgery. But when people hear of surgery, there's a fear, there's anxiety, there's concern, and they say, no, I don't want to go for that too. So you would avoid the surgery, but you would go for other options that are not proven to be effective. Not only are you wasting time, you are also wasting money, and you are also reducing your own quality of life. So this is a forum to let you know that if you are dealing with cataract, please visit an ophthalmologist and schedule for a cataract surgery. And for people that have glaucoma is basically you having raised intraocular pressure. There's a normal pressure in the eye, just like you have your normal blood pressure. So if there's anything that increases intraocular pressure in the eye, then it can start damaging the optic nerve and then take vision away. That's basically the pathophysiology of glaucoma. So glaucoma is just mainly high pressure in the eyes. And sometimes at the earliest stages, you may not have any symptoms, but there's also a family history of glaucoma. So if you know any uncle or brother or father or mother or grandparent that went blind, I think you should find out why they were blind, or note that, and you start going for regular checks, your eye checks. And if you have certain conditions like high blood pressure or diabetes, you should know your regular eye checks are mandatory.
Okay.
Very, very important, because those conditions can make you have eye complications. Hypertension can give you hypertensive retinopathy, and diabetic retinopathy can also occur from uncontrolled blood sugar. So all these are important things that people should take note of. Your eyes are important. If you're diabetic, if you're hypertensive, please always check your eyes at least once a year. And if you need to do anything, use corrective lenses, or you need to be on any medications, please adhere to all your prescriptions. And there are drugs available for glaucoma. There are eye drops to lower the pressure in the eye. The pressure in the eye should not exceed 21 millimeters of mercury. But for some people, you have it very, very high. So please don't even wait for it to hit 21. By the time you are hitting 18, 19, then you start going for your regular health checks, particularly when you have a positive family history. So it's very essential that all these factors must be considered. Then you also have macular degeneration. Macular degeneration also occurs in the elderly age group, whereby you need some antioxidants to help with the macula. That's the part in the back of the eye that links the optic nerve, where it connects to the optic nerve. So it's very, very essential that you are on very good supplements. I don't want to mention the supplements here, but there are some very essential supplements that as you age, they reduce in your eyes, and you need them. The luteins, the zeaxanthins, there are very good brands that contain those components.
Let them come here for adverts. we will do it for them.
Okay, then you can eat healthy also. Diets rich in beta carotene, rich in antioxidants, in lycopene, all those will be beneficial, and we can restore our sights, when things are not advanced yet. But when glaucoma is advanced, it's a vision thief.
They don't spoil.
Yes, it carries the vision away, and that's the end. And life, really, I don't know what life would look like without your eyes.
Voice of the People 90.3 FM. I'm just marveled. Okay, now somebody sent a message to me. He said, okay, here he said, I want to ask, why do I always have stomach issues? I keep purging every day. And I've treated typhoid and malaria, but yet I still purge every time. There was a time I went for a scan and the doctor couldn't see anything. There's one thing again, I did test and they said I had ulcer. I can't eat. My stomach always running up and down. I went to a pharmacy on Sunday to get typhoid and malaria. I told the man to give me, amoxicillin. But later I told him how my tummy was doing me, and he gave me Dosicap and one drug like that. So to stop the purge, which I took, and 3 days I didn't go to the toilet. And yesterday I managed to I went to the toilet, but the purging started again till now. So what should I do next? Because I'm tired.
Yeah, that can be very frustrating. I understand that. First and foremost, just make sure that you are well hydrated, because when you are stooling repeatedly, you're losing fluids and electrolytes, so you don't want to be dehydrated, first and foremost. Then, secondly, we need to find out why you're having those frequent stooling episodes, because it's not just enough for us to just give you some medications to stop the stooling. We want to find out why are you predisposed to that. But from what he has explained, he said they diagnose ulcer. I don't know what method they use to diagnose the ulcer, because we hear all sorts of things from different labs nowadays. But if you really want to find out whether you have ulcer, the best way to find out is by endoscopy, to have an endoscopy done, and then you actually visualize the ulcers, whether there are areas of gastritis, inflamed stomach lining, or inflamed parts of the esophagus if you're having heartburn and all that. And they will actually see the ulcers, the ulcerations will be evident on the endoscopy. Also, the H. pylori infection, Helicobacter pylori infection, is also something you should, endeavor to carry out, because that would also help us to know whether you will need a combination therapy to eradicate that, so that you stop having the abdominal discomfort. But I think what he is trying to describe sounds more like irritable bowel syndrome to me, because there's something called irritable bowel syndrome, where your bowels just seem angry all the time. You eat certain kinds of food and there's a flare up of everything messes up. You find out that you're going to the toilet frequently and you're having cramping, some uneasiness in your abdomen. It's really, really something that the diagnosis is missed quite often, because a lot of people would have been treating different things, but they still find out that these symptoms still persist. And another thing is that people that have abused a lot of antibiotics over time, there's a normal flora or bacteria in your digestive tract. So you've washed those out, and then you've caused an imbalance in your gastrointestinal flora, and you may need to be on probiotics to feel better. So certain things are called probiotics. They are beneficial bacterium that you have actually eliminated from prolonged use of antibiotics. And if you go to a good pharmacy, they are available. But I don't recommend that you go and get them yourself. You still need to go to the hospital, let a doctor examine you, let a doctor do a detailed assessment of your case. And if he thinks that you'll benefit from probiotics, then you may need to be on probiotics. But if it's inflammatory bowel syndrome, you may need to also keep a food diary and watch out for the kinds of foods that you eat that may precipitate this. Sometimes people also have food intolerances. Maybe when you take lactose, or you take certain kinds of foods or certain types of fruits, you notice that you are prone to this kind of symptoms. So essentially, watch what you eat and notice when these symptoms present more, so that you know what to avoid consuming.
I was diagnosed with glaucoma late last year. I cannot see with my right eye. I was having serious migraine until I had a surgery late last year. My dad also cannot see with his left eye. I'm 28 years. The migraine reduced drastically after my surgery. My question is there any way my left eye vision can be improved?
Well, I don't know where you had your surgery, but I would want to believe that you did it at a good center. So basically, you should still be going for follow-up checks and assessments. And when you go for your follow-up check and assessments, when they assess the status of your eye, we'll be able to know, what is really going on with that eye you can't see with. Is it only glaucoma, or are there other coexisting eye conditions? And then the ophthalmologist will decide what the best line of action would be.
Okay. This person is saying, please, my eyes, I see white things there at my left hand side and I cannot see well. What is it called? What might
white
that be?
things? Well, sometimes cataracts can be seen as a cloudiness. You just look at the iris, you see something there, in the black of the eye, you see something whitish there. That can be what the person is describing. And it could also be pterygium, which is like a fleshy growth that grows from the side, that grows towards the black of the eye. So pterygium is something that is very common also. And we advise that if you notice that you have any of those things growing, they are like fleshy strands, like that, almost covering the eye. So once you have that, we advise you to reduce your sun exposure, to wear dark glasses while you're in the sun, because sun exposure has been shown to actually make it progress faster and grow at a faster rate. And of course, it can be surgically excised also.
Okay. Let me also read what this person is saying. I'm sorry, sir. I don't welcome voice notes or voice messages. Just send a text message. We'll be wrapping up anyway. We'll be wrapping up very soon. And he's saying, can you recommend any place in Lagos where I can go and have a good? You want me to make advertise for that person? That's why I'm asking all health. What do they call them now? Practitioners. All right, those hospital owners and those
Diagnostic centers.
centers. Come around. Let's talk. Let's talk. Let's talk. Okay, let me just read one or two messages and I'm done. Please. A woman took.
I'm sorry to interject.
Okay.
If the person wants a good place, the person can reach me on my.
Oh yeah, yeah. No, we'll get there. We'll get there. Don't worry, everyone. Just get ready with your writing material. At least doctor will give us his handles, right? So you can go ahead and, of course, ask your questions. And okay, so just relax. Just make sure you get something to write on. Okay, please. A woman that took family planning since 2020, she can't see her period. What can be done? Since 2020.
Since 2020.
Family planning.
And how old is she? We don't know how
Oh,
old she
no,
is.
no, no.
Okay, so basically the best thing she can do is, we don't know what type of family planning she did. Is it the implants? Is it the injections? We don't know. So we need more information to be able to help that case. So, but the best thing she can do is to present at a good gynecologist for a good assessment. And then we're able to run some important hormone profile and run some important scans so that we're able to know why she's not seeing her period, because there's certainly a reason why everything has blanked out like that. So she may also need to change her method of contraception. Did she say she took it out, or she has been on it since then?
I didn't. She didn't really.
She didn't specify. Okay.
Itchy eyes. Itchy eyes. What would you say?
Itchy eyes sounds more like allergies. You have allergies. Allergies can present in different ways. It can present as itchy eyes, teary eyes, red eyes. It can also present as sneezing, itching your body that we call pruritus, or even itchy ears too, or itchy throats. Allergies can present in any of those fashions. So it's important that the person, presents at the hospital, have a detailed assessment done, because it sounds like allergy to me. So she can be on some of the anti-allergies for some relief.
Okay. Let me read this message. It said, I and my wife had a little delay after our wedding, like a year plus. We were still looking for a child. My wife went for several checkups and several treatments, right? Not knowing I was the cause of the problem, until we went for a proper checkup and the test, where I was told my sperm count was about 7 what now. Both of us were placed on treatment of infection. Then after 10 days, I began taking a particular drug though expensive, but after finishing the first cup of drugs and then the second cup, and eventually my wife took in. Please, can you call me? Oh, no. All right. Why is it that anytime I close my eyes and maybe touch it, once I open the eye, I won't be able to see clearly. And most times one of my eyes doesn't see clearly.
It depends on your age, and a lot of people have diabetes without knowing, and a lot of people are hypertensive too. They are not on medication. So like we said, these conditions can have eye complications. So you go for a proper assessment, go for your annual health checks, have your sugar screening done, have your blood pressure checks done, have your eyes checked. Maybe you have some refractive errors also. And if you need some corrective lenses, those will be recommended for you.
Okay. One of my colleagues at work lost her 5-year-old baby due to stooling. She was taken to a general hospital, but due to their negligence, the baby died. She was buried yesterday evening. We don't really know what caused the stooling. It is well. Our hospitals really need to do better, He's saying that our health sector is really, really so weak.
Well, yes, I would say, in terms of being overwhelmed with work, the burden of patients and few medical practitioners, the workforce is not commensurate to the population. We have fewer doctors compared to the general population. Then aside that, all that you need to work effectively, is not available. The health institutions are not, they still need a lot of refurbishment, need them to work optimally. And another factor with this particular pathetic case that was raised is the fact that we don't know how quickly the child presented at the health facility. Because sometimes if you hear a story like this, although it's very sad to hear, but we know our people too that they don't present at the hospital until something has really gotten out of hand. You know, we don't know how long the child has been stooling before the child was taken to the hospital. So these factors need to be considered as well.
We'll leave it there today. Your handles, how to reach you, how to talk to you, and all of that. Let's get to that point.
So on Instagram, I'll respond to messages. I'll respond to chats at 24 hours Medicare.
24 hours
Medicare.
Medicare. One word, right?
Yes.
24, not like
24, 24, HOURS, MEDICARE.
24 hours Medicare. One word. So
Yeah,
everyone,
one
that's
word.
it on Instagram only, right?
Only for now,
So you have to be on Instagram, okay? Instagram, 24 hours Medicare. Very simple. Write it down now. And
so I can answer more questions.
yeah,
if
there,
you need.
not here. We need to talk some other thing. 24 hours Medicare. The Medi is MEDI.
MEDI, yes.
Beautiful. One word. 24 hours Medicare. Just write them together on Instagram. Doc, thank you so much.
Thank you for having me. It's
Thank
my
you.
pleasure.
Thank you.
So much.
Thank you. Somebody saying, let me say like Yoruba man, Agba doctor. But thank you anyway.
Thank
That's
you
just
so
to make
much.
you laugh.
Yeah, thank you.
My name is Jude Ikami Jude. I will see you again tomorrow. 7 a.m. is the time. God bless you and bless you real good. On social media, you can reach me on my own is not Medicare. My own is Ikami Jude. Just simple. All social platforms, just go type IKAMIJUDEH, and my own too is one word. It's always one word. We don't like to. Okay, IKAMIJUDEH. Okay, that is it, and we get to talk there more. I love you so much, everyone. Do have a beautiful and a wonderful day. Don't forget, what's it called? The book by Peter Anosike is still very much available. I've asked those who have paid to come around and get it as quickly as possible. Yeah, just come around and get it. Yeah, I told you it's just 5,000 naira. Or you call. Oh, sorry, did I say call? Send a message to the number 070-121-46454. 070-121-46454. Okay, let me leave here. But before I leave here, I'm dedicating this song to all my Muslim brothers and sisters. Yeah, the ones who they fast to. I know some day on that bridge now, they chew mouth seriously. Those fasting, I am dedicating this song to you. We're giving thanks to Allah. My name is Judah. Michael Jackson will help me deliver this song. I'm out of here. Oh, it's afternoon already. Good afternoon.
Thanks